I clicked it. Let us know, Neki.
All right. Good
We
morning.
good?
Yes, we're good.
Good morning, Neki. Good morning, Lisa.
Good morning.
Good morning, Danny. Okay, so welcome to Poly by Design and the COVID-19 Pacific Islander Response Team's COVID Talanoa. This is our third show. We have a member of the medical profession with us today, and then we have a member of the community that has a personal story to tell about their relationship with COVID-19 and their experience. So it's a Talanoa setting. We are going to all talk, all chop it up, and give our points of view as we go. So I think we first want to introduce our speakers and our guests to everybody. So I will let Neki go.
Yeah, so good morning. We're going to introduce Liza Merrill. Lisa is a personable, trusted, and respected community organizer with over 30 years of relationship building with the diverse communities in Arizona. She has experience working with local and state agencies, community-based organizations, as well as connections to national Asian American and national or NHPI. And I just lost it. Sorry, Lisa.
It's okay.
Did you get out of there or?
There you go.
Okay, let me start over. I apologize. She has experience working with local and state agencies, community-based organizations, as well as connections to national A and NHPI groups. She is successful in planning and implementing community events and is a vocal advocate for the underserved and minority populations in Phoenix, Arizona, and nationwide. Welcome, Lisa.
Good morning.
And our medical professional guest is Daniel Malepeai. He holds a designation of RN and BSN. Daniel has worked as a registered nurse for 3 years with experience in med-surg observation, emergency room, and is now working as an advice nurse. He holds a Bachelor's of Science degree in nursing, graduating in 2017 from San Francisco State University with honors. He also obtained an associate's degree from Los Medanos College in 2008. Before nursing, Daniel worked as an EMT, providing emergency medical services to the people of Alameda County from 2009 to 2017. Welcome, Daniel. So, what we've been doing in this series is trying to hear from different points of view in terms of COVID-19. So we're not, if you're watching on Facebook Live, we are not a statistics or data-driven show. We are about hearing the stories of the people and their experiences with COVID-19. There may come a time where we later on put data and PowerPoint slides up and those kind of things, but this is really about hearing the voices of people that look like us, people that have lives like us, and then people that what is your experience with COVID-19? So we really wanted to dig into your experience, Danny. First about you're a frontline medical worker. So COVID-19 is obviously a dangerous. It's a infectious disease that every normal person has to worry about. You in your work and your activities. So you have like your personal life away from it, and then when you go to work, you're dealing with it. So it's really a 24/7 thing for you. Just talk about your own experience as you got into the position you're in now, and kind of your experiences every day with COVID-19. We can't.
I think you're on mute.
He's not on mute. See, we could hear him earlier. No, we still can't hear you.
Can you hear us?
Can you hear us?
I can hear you guys. Can you hear me?
Oh,
There
yes,
you go.
we can hear
There
you
you
now.
go.
There you go.
Yep.
Sorry. Um, yeah, so thank you for this opportunity. I'm happy to be part of this and speak from my experience. Um, I currently work as a nurse at one of the Kaiser call centers. Kaiser call center is kind of a little Kaiser hidden secret. A lot of people don't know, but I mean, you can call if you have any symptoms and get the help of a nurse to sort of triage you and provide advice when needed, and also get you to the correct resources when needed. If you would need to go be seen at the emergency room, we work with some of the ER doctors as well, and also making sure that people get appointments when they need them. So, in terms of COVID-19, I get callers every day. Every day, there's been a real big increase of the call volume for COVID-19. Since we have started in receiving calls about them, probably late February, early March. Um, so I haven't been taking any of the care of any of the patients in the hospital, but I still have a lot of friends who work in the ER, and I'll talk about what they've been seeing as well. Um, in the call center, a lot of people are calling in with mild symptoms most of the time. It's usually a sore throat, um, a, a little bit of a dry cough, or I can't smell, I can't taste. Very mild symptoms. And just with coronavirus, there's just such a wide range of possibilities with it. Usually, you would just blow off a little cough or a little sore throat and do what you need to do. But coronavirus has changed the way we look at those things for the time being in this pandemic. So a lot of people call in with those things, and we want to make sure that we're able to provide them with a test when possible. With that said, a lot of people who are positive, who are quarantining at home, are calling in to the call center to speak to advice nurses because they've had changes in their symptoms during the course and the progression of this illness. And, sometimes it turns into shortness of breath. Um, and how we define severe symptoms of COVID-19 is, um, you know, not solely determined on oxygen level, but if your oxygen level, you can get a little finger oxygen saturation that you put on your finger. The home ones they work okay, but it's a little tricky to do. Sometimes you get inaccurate readings, but people have been buying them on Amazon and wherever. They're getting hip to technology and what you need to monitor yourself at home, and um, you know recognizing that they're having low oxygen saturations, they're feeling more short of breath, so they're calling in, and we got to send them to the emergency room.
I bought one of those. My wife bought one of those, so I've used that, and I actually gave it to one of our coworkers at Poly by Design because she had contracted COVID-19. When you get the phone calls, do you find that there's been so much information out there about COVID-19 and disinformation as well. Do you find that the callers are um, not as educated to COVID-19 as you would think, or do you find that they're more educated to COVID-19 than you would think?
I would say they're more educated. It's hard. People look up the red flags. It's easy to Google them and easy access to them, which there's pretty good information out there. The problem is, with the media and this pandemic situation, there's just so much information kind of being funneled into the media, and it causes a lot of confusion because the studies that you know are what we rly on as evidence based to prove certain you know things about the illness. They're being rushed. I mean, usually we'll have what we call peer review where someone does some research and then they submit it to one of the medical journals, and a team of doctors in that field of expertise will review it for accuracy. And that process takes a long time. And, with the pandemic, we really don't have that kind of time. So a lot of information is just coming out,
Yeah.
and it's not all accurate, which is hard. So I can, try to provide, some of the information and data on what we know is true, during the course of our talk here today. But yeah, I think people are recognizing the red flags, which is good. Um, when they're calling in, just this is the information age. People can look up stuff and realize, but there is a lot of confusion out there as well.
Hey, Danny, when people call in, do you recommend if they're having any kind of problems breathing, do you tell them to go to emergency right away? Or is there a certain level that you tell them when to go, or should they use their own discretion, or?
Yeah, so um, it gets difficult to assess shortness of breath over the phone. So it's you got to be very careful and thorough about it as much as you can. So I mean, listening to someone talk, like I mean, you've been hearing me talk. I talk full sentences. I don't
Right.
take any breaks, right? So if somebody's having to stop to breathe every 3 to 5 words, then they're short of breath. I can tell. Or if I hear them
Yeah.
gasping for air in the background, that's severe shortness of breath. Difficulty speaking or gasping for air. A lot of people feel shortness of breath, but they can talk a mile a minute.
Yeah.
So that shows me objectively that, okay, you're not as severe as they think,
Right.
but the fact that they feel that way is important for us to take seriously as well.
Yeah.
So yeah, just assessing the severity of it. If I heard somebody was gasping for air, um, I would send them to the emergency room, no doubt. And I have to decide whether I need to call 911 to get an ambulance down there for them, or if they're safely able to get to the hospital by other means of transportation. Otherwise, our other options are I can consult one of the ER doctors as well. There might be something I'm missing sometimes, and they're a great resource there as well that we call frequently, and they see these in the emergency room, and they know a lot more than we do as nurses. So
That's awesome.
I work the COVID-19 helpline at my 9 to 5. So we field a lot of questions about. My wife works at a school, and somebody at the school tested positive. So should I stay home from work? And so we're very definitive on what we call exposure. Um, how are you handling those kind of questions when people are saying, my somebody at work tested positive, do I need to self quarantine? How do you break that down, and what are the questions you go through with a person so they know whether in the medical terms they've been exposed versus just working at a same place that somebody else works at that tested positive?
right, yeah. So basically, what the CDC is saying, those are the guidelines that we follow in the hospital, and they've changed. I mean, initially it was 6 feet apart. I mean, within 6 feet for a 30-minute period of time, and now they're saying 15 minutes. So within 6 feet for 15 minutes is considered close contact. So if you've been in that situation with somebody who's positive, I would say even if you're wearing a mask, I think it's grounds for quarantining and speaking to your doctor at the very least.
That's
But
the same thing that
yeah,
we're the same thing we're saying is the 6 feet for 10 to 15 minutes, continuous close contact. That's the close contact analysis we have. And it just reinforces the social distancing piece when
Right.
I'm talking to people that are saying, oh yeah, the 5 of us were in the office all together. And I was like, what was the priority that would make you all 5 go in the office together?
Right.
And stay in the office for half an hour? Like what was, like what was the priority? And usually there's not a good answer. It's just they didn't really think it through as to, it's 6 feet for an extended period of time. But I think it just reinforces, at least in my eyes, it reinforces the strength and the power of social distancing, because just by the CDC's own definition, if I socially distance, I'm going to be okay. So I appreciate you
Yeah.
sharing that, because it's
I
good
had
for
no
us to know.
idea. I had no idea that was considered, 6 feet apart, but talking to somebody or interacting or, for 10 to 15 minutes, then that's new information for me. So thank you for that. Lisa, did you experience any of the symptoms that Danny was talking about, or do you know someone, or did you contract COVID-19?
Well, my husband, there's 6 of us in the family. Well, 6 of us in our home. I have a sister-in-law she's actually visiting from Denver, Colorado on her way to Guam. Then I had a brother-in-law who came in from Oklahoma. And so that was a hot spot.
Yeah.
So when they came in, we all quarantined ourselves voluntarily. We made sure my brother-in-law came in with a mask, and, because he's older, he's diabetic. So, we were very careful. When my sister-in-law came in, we stayed within our own confines. My husband is a construction worker, so he has to go out every day. So for a while, they had been here since June, was that May, June? So we thought as a family vacation, we're going to go, we've been safe, we're going to go to California and visit a nephew. And my oldest daughter wanted to go with us, but she had been exposed, at work. And I said, no, you need to stay home. We don't want to get everyone sick. So thinking to myself, oh, okay, we're safe. We're going to go to California, stay with our little family and stay secluded in my nephew's house. Little did I know, I have a younger brother-in-law who lives here in Arizona, and he had been coughing, and we had to split the drive. So my grandson and my oldest brother-in-law rode in his vehicle to California. My brother-in-law had a mask on. He kind of like, oh, I don't have COVID, I just have a cough. And so my brother-in-law kind of took his mask off. They drove to California. We drove later on. We had a little visit. My brother-in-law stayed in his room most of the time because we kept saying, are you sure you don't have COVID? Wear your mask. And he doesn't want to wear a mask. He doesn't believe in mask. We come home. My brother-in-law, comes home first, and then we come in seconds later. Monday morning, he starts feeling chills, body aches, a fever. I was so afraid because he's older and he's diabetic. I said, we're all going to get tested. So we weren't able to get tested till Wednesday. And by then my brother-in-law started experiencing, it got a little bit worse, but not really severe. So he was symptomatic. So we all got tested. My husband got tested later. Then my grandson, he's 15, he experienced a little sore throat. So I said, okay, we've got to make sure we've got to quarantine within ourselves also. But, I watched, he didn't have a fever. My brother-in-law was okay. Then my husband, after we got tested, because we were waiting for the results, he was we all stayed home. Then the following Thursday, he was going to do a job, a construction job. He walked from our bedroom, we're 2-story. He walked from our bedroom to the stairs, and I said, you don't know if you've been exposed. And he said, I'm fine. He got to the top of the stairs and he couldn't walk down the stairs. He sat down and he says, I don't feel good. And I said, you need to stay home. So he stayed home. And needless to say, I'm sorry, he started to get fevers too. Like 103. 104. He was so burning up. So I made him stay in his room. And I mean, his eyes were red, his body was red, everything was red. And everybody else, all the rest of the family quarantined in their own spaces. And I told my husband, you need to stay in this room. I know we haven't got the results back. And I'm sorry, I didn't realize.
No, you're fine.
Don't be sorry.
No,
Don't
be sorry.
apologize.
Take your time.
So anyways, I didn't realize, you know, he's the strongest of all of us. He played basketball all the time, every night. You know, he had a huge appetite. And he was the last person I thought would get sick. Me, my exercises from my desk to the refrigerator, you know, it's like, I don't do much. So it really shocked me. And he himself said, I'm okay. And I said, no, you're not. So we got a thermometer, you know, and my brother-in-law, luckily he had one of those thermometers, and I started to monitor his fever. And it started like, you know, 100. Oh, I'm fine. 101. To where it got to 103, and you know, you could go into convulsions.
Yeah.
And that terrified me. So I said, you need to go and a cool shower. You know, by then he was kind of weak. I said, go take a cool shower. I'm going to go, you know, I started giving him, and you know how they said, don't take what's that, Tylenol or something like that. And I read, and ibuprofen. So I started giving him Tylenol to you know, try to control the fevers, and it didn't. It kept them like to 101, but it was like 4 or 5 days he had fevers, and he couldn't get out of bed and didn't want anything to. And so we already knew we had it. You know, we just didn't know how it's going to affect everybody. So my brother-in-law, who was the oldest of us, he was, thank God, you know, he was okay. You know, he just had little aches and pains. Then he lost his sense of taste and smell. And so, you know, he was fine. But my husband was the one that was the scariest. And I kept him in the room the entire time. So he ran a fever for about 7 days. And, you know, I stayed with him. I know you're supposed to like isolate yourself, but there was no way I was going to leave my husband.
I know.
You know?
I know. How can you, right?
Yeah. And you know, he's a Pacific Islander. We're from Guam. He's Chamorro.
Yeah.
So he's a Mr. Macho. Oh, I'm okay. But you know, you're not okay.
Yes.
You know,
Yeah.
I said, you're staying in bed. And so I stayed, you know, I made sure I around the clock. And he's so funny because we'll have medication, and it was a liquid kind of Tylenol. I mean, well, you had the pills first. And I said, you need to take, you know, like 2 to make sure. Oh, no, I'm just going to take 1. And I go, why? Well, we need to save. Save what? You know, it's like, you got to just take it.
Right.
And then I would always give him drinks, you know, make sure he would hydrate, Gatorade, all this kind of stuff. And he didn't really want to eat. My sister-in-law is a wonderful cook. So she cooked all the Chamorro foods, you know, the soups, but he was never hungry. So that went on for about 7 to 8 days. And then when we finally, we didn't get our results till 10 days later. And, you know, when we actually, so we still didn't say we had COVID, but we were treating the symptoms as COVID. And so by the time he got his results by the 8th, you know, his fever finally subsided to where it stayed at like about 100, 101.
Wow.
Then the coughs started. He started having the coughs. And I was, like you said, you know, the oxygen thing on your fingers.
Yeah.
So when close friends of ours found out we had COVID, because we kept it within ourselves. But of course, when we notified my nephew who we were with, we notified the rest of our family, and his brother, who didn't believe in COVID, didn't believe he had it. You know, he didn't say, I didn't take, you know, I don't have it, but he got tested anyways and tested positive.
Wow.
He still said that it's wrong. They make those things up. They just knew I was sick. And I was like, and so anyways, I was like, okay, it doesn't matter. We're not blaming you that you spread it to us, but it had to start somewhere. And I said, we just wanted you to get checked so that you don't pass it on to someone else. But he was asymptomatic. He didn't have any symptoms whatsoever. So that's why he still, even to this day, say, oh, you guys didn't get it from me. But anyway, so we when we finally got the notification that we were so what happened is 6 of us got tested. The ones who were symptomatic, my nephew, my older brother-in-law, and my husband all tested positive. Myself and my sister-in-law and my brother who also lived with us, we tested negative. So 6 and 6. And of the 3 who were infected, it was all different degrees. You know, my grandson just a sore throat. My brother-in-law, aches and pains, a slight fever, loss of sense, you know, smell and taste. My husband, you know, the most severe. And so as he was starting towards the end, his fever subsided a little, then the coughs came in where they're just hacking coughs. And that's where I was afraid that, you know, if he wasn't breathing, is he getting enough oxygen? So I was one of those that went to Amazon,
Yes.
bought the oxygen, because that was one of the things that they said, if it goes below 90 to the 80s, you got to go to the emergency room. And then a friend of mine says, you got to find an emergency room or they'll accept you. So while my husband was, I was doing all this research, Googling, looking at things. And the conversation we had prior to when my husband was sick, he was saying, you know what, Lisa, we need to get on top of this. What about that hydrochloroquine and the Risperidol, you know,
Yes.
and he goes, maybe if we start taking that now. And I go, excuse me? I said, you think a doctor is going to prescribe what's an asthma medicine to you when you don't have asthma just to prevent getting COVID? And he goes, well, if we get COVID, you know, what if we get COVID and something happens? And I'm like, no, we're not going to do these preventative stuff with real medication. Maybe getting vitamin C, you know, doing some supplements, vitamins, I'll do that. And then I felt so bad when he got sick. I was thinking, oh my God, should I have done that? You know, what did I, you know, it's like, if something happens to him, you know, it's my fault. I should have prevented it. But anyways, then we moved forward to where he's coughing. We called the doctor because I was getting scared. And I'm on the side, you know, it's one of those teledoctors. My husband's facing the doctor and his poor face looks so sad. And here I'm on the side going, ask him this. And then, you know, the doctor's like, is that your wife?
Just put her on.
I said, yes, it's me. Because, you know, my husband's like, yeah, well, my wife told me to call you. And I said, tell him this has happened. This, you know, because he always downplays it.
Yes.
So,
like most men do. I'm going to throw that out there.
Yes. And so, but the saddest thing is when we talked to the doctor, he said, there's nothing we can do.
Wow.
There's no cure.
Yeah.
And I go, you can use over the counter for the cough. I have medication that I can give you for the cough, but to be honest, it doesn't work. You know, so for him to hear that from the doctor, for me, it was like, oh my gosh, it's in our own hands. Unless he gets, and all he can say is, unless he has difficulty breathing, then go to the hospital. So basically, you know, that's all we could do. And so I put him back to bed. I said, that's it. You've got to stay in bed. And, you know, and I kept pumping him. Now I start pumping him with the Tylenol and the cough medicine. And, you know, like clockwork, I would look at it and say, okay, it's time for your medication. And my husband would just give me half. I go, why? Well, we have to save. Save for what? You know, it's like, it doesn't work if you don't have the complete dosage.
Right.
You know, and so I always had to fight with him. I would pour it, like, drink this, you know, and then he would drink it and stayed in bed. And so finally by the 25th, he was feeling a lot better, but he had lost 12 pounds for almost 2 weeks.
The 25th day or the 12?
So,
I was like, oh my gosh.
Like 17 days later. So he started getting sick the 8th. By the 25th, he started feeling better. So
wow.
What I did was I gathered all of our family together again, and we got tested again because I wanted to make sure everything was okay. When we all got tested, at that point we tested negative. So finally we were, you know, all negative. But he lost 12 pounds, which I was very jealous of because
right.
But then I knew he was really well when he had his first meal and he wanted rice and spam.
Yes.
Confirmation.
So we were on our way to recovery. And after that, I have to tell you, after that episode, you know, I was reading posts and getting contact with family members. And I had a nephew who was 43 who died from COVID. The day that we were tested negative was when they told me that he had passed away. He had been on a ventilator. And then I had seen other, you know, families in the Samoan community in Arizona who have passed away as well. And it was so heartbreaking. And I usually don't like to post our personal stuff on Facebook, but I had to post that we were lucky. My family was very blessed and very lucky because we had health care. We had access to health care. We had a loving family that helped us. My sister-in-law, my brother-in-law, we live in a 2-story. So when my husband had a hard time coughing, she would boil. I mean, we used the old remedies. She would boil a big pot of water and we put Vicks in it. I don't know if you remember Vicks.
Yeah.
You know, my mom used Vicks all the time.
Yeah, mine too.
You know, and she used that. She would boil it. My brother-in-law would bring it upstairs. I'd get it at the door of her bedroom. I put it next to my husband. We opened the cap, you know, the top, and he would inhale it to try to, you know, just open up his airways. And then every night, my sister-in-law had alcohol. She sprayed wherever we were the next morning. So, you know, she made sure that everything was clean. So we sanitized within ourselves. Because she wasn't sick, she tested negative. She wore a mask. You know, even with next to me, she wore a mask. My brother-in-law, who was already, you know, had tested positive, they did it. But because I had to protect my sister-in-law, she wore a mask. It didn't offend me at all. I didn't wear anything, but I washed my hands constantly. I had towels I gave to my husband, you know, to when he coughed because of the you know how they say the droplets.
Yeah.
And I have to tell you, at night when I'm sleeping, we usually have a fan going. I turn the fan on, and my covers are like this, and maybe my nose is just like this because in case he coughed, you know, I was trying to still protect myself. I'm still next to him, but protected myself as well. And so, you know, we were very lucky.
Yes.
You know, he still has a cough when he comes home, and I think his cough acts up when he's tired. But I'm the cough police. He always tells me, "You're the cough police," because as soon as he starts coughing, I run, I get a towel, and I throw it at him, and I go, "Put it on your face," you know, because we don't want it to spread. And
Yeah.
but it was scary. And I was so mad at him a couple of days ago because he downplayed it. Of course, now he's, you know, oh, my wife, you know, people were calling, "How are you doing?" "Oh, you know, my wife, she exaggerates," you know, and I'm just like, oh.
Oh,
So, but like I said, it's terrifying.
I'm so happy he's better and the whole family is better. It's
Yes.
it's a blessing because so many people, a lot of PIs have lost their lives, and you know, we a lot of the you know, we live in multi-generational homes. You know, that's just how we live. We have our grandparents, our nieces and nephews. We all share a home because that's just what we do. Danny, do you know if the people that you hear of, or what you see or what you hear or data, do you see those PI numbers at all, just out of curiosity? Or
So not personally, I haven't seen them, but you know, I looked up statistics because they post it based on
Yes.
ethnicity, and you know, I've seen what California has had, and um, I mean, for California PI, you got to remember that it's just a small population relatively to the entire population of California. So it only shows 0.5%. And a month ago, it was only 0.4%.
Right.
So I mean, it's a small piece, but in the Pacific Islander community, it's pretty significant.
Yes.
So,
Yeah.
like you said, I mean, having households that have several family members. I know a lot of us grew up that way, We have elders in our homes as well. So that's the problem with it is we really have to be careful with that. There's a lot of people going in and out of the house doing different things, and
Mm,
the potential for someone to come and bring something back and be asymptomatic, which is no symptoms at all,
Mhm.
and give it to someone is there. Because
yeah,
half of 44% of people who have COVID have no symptoms or
Right.
very little symptoms that you can't even tell. That's a big
wow.
that's a big percentage. I
It's
mean,
a
I'm sorry,
huge,
44% of those, yeah, 44% of all the people who are asymptomatic are shown to be contagious, is what I meant.
yeah.
But 80% of everybody who has COVID is very mild to no symptoms at
Mhm.
all. So
Wow.
it's a huge factor that I think that a lot of people in the Pacific Islander community don't realize because they don't see it, and
Mhm.
we haven't had our hardest day in the Pacific Islander community yet. It's to come unless we change our behaviors on the
Yeah,
daily basis. We have to have more accountability.
yeah.
Definitely.
So yeah.
And that's why, because I was negative the first time, I had to make sure I got tested again because I didn't want to be, I had to make sure I wasn't the one that was asymptomatic and passing it on to others. And in our culture, when you meet with family, they kiss you, they hug you.
Mhm.
We always say the tomorrow kiss is that you inhale, the kids,
Yeah,
the people. And so you always make sure your kids took a bath before you met family members.
yeah.
But now, I didn't go to so many functions because of COVID. And when I actually went to one small function of 15 people, they're like, oh, don't kiss Auntie Lisa, she's COVID, don't. And then I felt bad, but I'm like, guys, I'm doing it for you. I'm
Right.
doing it for you because I don't know what I might have, and I want to protect the people around me. And that's the same thing with the mask.
Right.
You wear a mask because you want to protect your family. And so, you know, wherever we go, we wear a mask now, even before we wore masks,
In
Mm.
and
one of our previous shows, we had a doctor on that said, it was interesting to me because we had a doctor on and we had a pastor on, and it was the doctor that said, "What does love your neighbor look like? It looks like wearing a mask. That's love thy
Mm.
neighbor,
Yeah.
because it's for them and it's not for you." So, if you're just joining us right now, we are with Liza Merrill from Levine,
Yes.
Arizona, and we're with Danny Malepeai from Kaiser Health, sharing stories about
Yes.
how COVID-19 has affected the Pacific Islander community. And Danny had just talked about the effects on specifically the Pacific Islander community. And I think that there are several factors that make it that much worse for Pacific Islanders. I
I
think the
just,
pre-existing health conditions,
Mhm.
diabetes, obesity, high blood
Yeah.
pressure, those are, that's high in Pacific Islander
Right.
community. And then the social norms of like, we like to celebrate, we like to gather, we like
Oh
to
my gosh.
enter the room, you hug and kiss and greet every
Mhm.
person in the room. You leave the room, you hug and kiss and
Yep.
say goodbye to everybody in the room. And I think that those, you add all those things up, and then kind of what you had talked about, Lisa, the kind of macho, like, I'm good, don't
I'm
worry about
fine.
me,
Yeah.
I'm strong. Thank God there's women in the community, in every PI community, to talk sense into the men,
Right,
because,
Nancy.
when you said guys say, they downplay it, that's like
Mhm.
how I do my doctor's appointments, is like,
Mm.
well, how
Yes.
little can I say to get out of the room? Like, I'm
Mhm.
good. Nope. Yeah, I'm good. And then just get out. And what you were saying, my wife will actually take the phone, and I'm talking to my doctor, and my wife will take the phone and ask the questions herself, because she's like, you're horrible at this. Like, if I
Mhm.
was a doctor, I would think there's nothing wrong with you because you just told me everything's good. So I thank you so much for sharing, Lisa.
Thank you so
It's
much for sharing your story.
yeah, it's brave.
It needed to be people, somebody needed to hear that, and that when you tell your story, you're actually saving somebody's life, like something goes off in their head. So thank you for that. I just wanted to shout out some of the people that are tuned in and are saying thank you for sharing your story. And thank you for Danny and Lisa, what you're doing. Manufo Liainga Hawaii saying thank you. Eddie Unatoa, who's coming from Hawaii. Lai Tofaiono. Hey, Lai. Evie Foley, who's my mother, she's saying thank you.
Hi,
Tony
Auntie.
and May. Tony and May, Laverne Malinga, Fo Unga Tafa, and Fa'ava Malepeai Langford. Ola Unga Tafa. I'm sorry if I'm killing your names. Mori Manamea. Maka, PJ is on, Loto, and I think every Malepeai in the Bay Area. Ira Jennings, good morning, Ira. Tons and tons of people are saying thank you for sharing your story and for giving them an insight of the call center and what, like me learning that being in contact with somebody, even if they're 6 feet, if I'm talking to them for 10 to 15 minutes, and they are to have diagnosed, then I'm at risk. I should go get tested. That's huge for me because I didn't know that. I had no clue. So thank you so much. And really telling your story and educating people, you really, really, the both of you are really saving lives. So I'm honored that you guys are here, and thank you so much. We needed to hear these stories.
And I think that like Naki said, there's, putting data on a screen and saying cases per state or percentages, that does reach some people.
Yeah.
But there's a lot more people out there that need to hear, the story about when I had COVID, or the story about when my husband had COVID, or, you know what I mean? Like how I, the feeling that I felt when the doctor said, there's really nothing we can do for you. Like you're either going to write it out and get there, or you're going to end up in the hospital. Like there's not any middle ground. To hear those kind of things and to see people that look like us tell the stories is really what's important. And to hear like manning the helpline and telling people, working with them as they're picking up the phone and just calling some stranger for help. And then you're the one on the other end of the line with, you're supposed to have the answers. These are the things that are really going to drive the message home. And that's why we really believe that the Talanoa style of us just chopping it up and talking about experiences and laughing at the same time about, we knew he was good when he wanted spam and rice.
Yes.
Those kind of things. But they make people feel the message. And we couldn't do that without people in the medical profession talking about it that look like us, and people that have family members experience it up front and close and personal. The tears that you shed today are, don't apologize for that, and you being brave to share your story, across that tens of thousands of people, literally tens of thousands. Naki knows the number, but tens of thousands of people will see this and hear your words, and it's going to touch somebody who's going to say, to your point, Danny, they're going to say, whoa, 6 feet. Like I can't ride in a car and be socially distanced with somebody. Like that's one of the things my work told me was like, people that are still traveling, you got to take 2 different cars. Why would I take 2 different cars? Because you can't socially distance in the same car. Somebody's going to hear that and they're going to learn something from your words, Danny. And then somebody's going to hear your words, Lisa, and feel your story and see the emotion that you're going through. So again, I appreciate the bravery of both of you coming on and sharing your personal experiences.
Thank you.
Yes, thank you so much. Danny, is there anything you want to get out before we close out? Any information that you would like to share, or any last words you would like to say?
Yeah, definitely some things I'd like to share here. And I just wanted to, say great job to Lisa for really stepping up and, pressuring your husband to, you know, up during this time. I mean, it's really difficult, and that's what makes it so difficult is because it's outside of our norm. I mean, we're usually with general cold, cough, flu, we're okay to just kind of tough it out. But this is a different thing. This is something that we've never seen before. Uh, Modern hospital, medical science, they haven't dealt with anything like with this, and that's why we're seeing, such a bad response to it because we're unprepared. And basically, I wanted to touch up on your comment about the mask, and I think that's good because a lot of people don't feel comfortable wearing them. But if we all wear masks, if every single person wear masks, not just one person in a room, if we all wear masks, we are doubling up protection and really lowering the risk of us getting contracting COVID-19. There's something called viral load. Viral load is the amount of the virus that you're actually breathing in or getting in some of your mucous membranes that get you infected. And when we're both wearing masks, if I'm wearing a mask and you're not, some of my viral illness is going to shed out into the space around me. And if you're not wearing a mask, you're going to get it. But if you're wearing a mask, you might have um, a lot less viral load that you're infected with, and you might have no symptoms at all, and might be fine. And that's important to know because um, a lot of people in our community, like you were saying, Carl, have a lot of pre-existing conditions as
Mhm.
simple as obesity. I mean, we have so much obesity in the PI community, which we don't even realize, and so many elderly, 60 and up, people with asthma, diabetes, heart conditions. I mean, the list goes on, and they're all at a lot higher risk than just the general healthy population. So it's important for us, even if you feel you're strong enough to beat this, it's important for you to wear a mask to protect and shield those around you. And also, washing your hands thoroughly for 20 seconds before touching your face, before eating food. I know a lot of us eat out, order food for delivery or whatever. The packages, you got to think about that. Who was handling your food? Who touched it? I mean, don't just open the package and then grab your food. Make
Mhm.
everything readily available to grab without touching the package, and wash your hands, and then go ahead and have your food after that. We have to change our ways because the virus can live on paper. It can live on cardboard for several hours. I mean, which, you know, if someone was just handling your food or what packages, whatever you may have, there's a chance for you to contract that. It lives on hard surfaces for a longer period of time. There's you really should try to wipe down surfaces that people who aren't in your home have touched. I mean, you got to try to wipe those things down. It's all stuff that's kind of been pounded into our heads um, with the media every day. So we kind of tend to just block it out now,
Yeah.
because you just hear it so much and you get tired
Yeah.
of hearing it. And then you may not see the effects of COVID in your circle,
Mhm.
so it may not be as relevant to you, but it is important because it will break into your circle at some
Mhm.
point if you don't do these things. And you got to think that we're just very close to getting a vaccine here. So if we just work hard, get all the things done that we need to do, just wear masks. Don't If you don't need to go somewhere, if you don't need to go out on this vacation, or if you really don't need to go out to this birthday celebration or whatever, don't go. We're talking about 5 months. You can go next year,
Right.
So people need to really start asking themselves, do I need to go out? Because the only thing that works 100% of the time is social distancing. That's the only thing that works. Of course, we can't social distance all the time. We need to go out to work. We need to go out and get food. So when we do go out, we need to mitigate that risk by wearing our mask, by washing our hands frequently, 20 seconds, and those things will help. we also need to realize that it's not just elderly that are affected by this. I think like a third of the people who have COVID from 22 up to mid 40s who are getting hospitalized are in that age range. So ended up in the ICU as well. So and sometimes, like I said, there's so many people who are asymptomatic, no symptoms at all. But when they get an X-ray of their lungs, they're seeing damage in their lungs, which we don't know what it means yet. It maybe 10, 20 years down the line, it might be a severe lung condition, but it's harmful to everybody because we don't know enough about it. We need to accept that, and we need to just be careful. So I think, those things: washing our hands, avoiding crowds, um, don't go in confined spaces, wearing your mask. Everybody wearing their mask. Don't pull it down for the picture when you're standing right next to somebody. You know what I'm saying? Don't wear it halfway covering just your mouth and not your nose. Wear it like you're supposed to. And that will help us prevent bringing unnecessary cases into our community. Um, yeah, I
Because
mean,
it's so hard, so severe on the Pacific Islander community. I think that knowing the preventive measures, I mean, that's the strongest medicine for us, is to not get it. So to take the precautions that we need to for a short period of time. To your point, COVID-19, there is COVID fatigue, and that is where, we're just, one of it is the information. There's so much information coming at us that COVID fatigue, a big piece of it is just clicking it off, just turning it off and going, look, I already know everything I need to know about it. I don't need to, hear any updates. And I'm kind of tired of, all these extra practices that I got to do. But, to Lisa's story, the point of like, there's not anything that we can do for you. It's the ER or you beat it. Just speaks exactly to those things. Like it's preventive. That's what we've got to do as a community, is not get COVID-19, because
Right.
it hurts us more. I think you're right from that standpoint of, you have two different immune systems. You have your immune system that keeps you from getting sick, and then you've got your immune system that fights the sickness once you get it. If you know if you're able to help your immune system that keeps you from getting it, the viral load, we're all susceptible to it at different levels. Like, why play a risk game and hope that my initial immune system is really strong? Wear a mask, socially distance when you can.
Yeah.
Those are the things that that we control. We don't control the vaccine. Is parent, maybe it comes. They still don't have a vaccine for AIDS, and they've been looking for that for 40 years. um, we can't wait for a vaccine to be safe.
Right.
Agree.
Right.
Yes.
So,
And
So
yeah.
yeah, just to mention this, I don't know if we're running out of time, but people, with chronic health conditions, you're more at risk. You can do more to protect yourself. If you're diabetic, try to manage your blood sugars as well. Just doing that will strengthen your immune system and ability to fight off infection if in case you do get it. It might, make or break how your outcome is if you get it. If have high blood pressure, do what you can to lower your blood pressure. Diet, medications, if need be, and exercise and weight loss. If you're obese, lose weight. If you control those chronic conditions, that also improves people's outcome as well. So it's important to focus on those things that we can control.
mhm.
So try to manage those things, live a healthy lifestyle while you can.
That's
And
great
if
And
advice.
one thing I did want to mention, because I know, you know, yeah, just when it comes to that gatherings, because it's like you had said, in our community, we're used to having gatherings, and it's hard to not go to stuff. But just know that usually one person can spread it to 3 to 6 people on average. But there are people, 10 to 20% of the people who get sick with COVID can spread it to unknown amounts of people. And we saw that in Washington when there was choir practice in a room and people were distanced apart, more than 6 feet apart. But 87% of the people in that room got infected from one person,
Wow.
and they were
Yeah.
in practice, they were singing, and it just was kind of the perfect storm for that to happen. But if we're going to parties in people's homes, not wearing masks, I mean, we're really increasing that risk of spreading this, and it's preventable.
Mhm. And if I could just add to Danny's comments that, we do have a lot of Pacific Islander family and friends who have underlying issues, but COVID-19 does not discriminate, because my husband has no underlying issue. He's healthy. He thought he would never get sick, and he got sick. So to our people who are healthy, to our family members and friends, if you're healthy, that's great, but you still have to be cautious, because it could affect you, and it could affect you even worse than anyone else, because COVID-19, we don't know a lot about it. So like Danny, with Danny's comments, we just need to practice, social distancing, wearing a mask, washing our hands, and just being conscientious of people around us, and don't overthink, and don't think that you're above getting the virus, because you're not. We did everything we could. We kept, away from family and friends. We cleaned I can't say personally, but my sister-in-law cleaned everything we had, and I don't want to take all the credit. And, we still got sick. And so, but luckily, like I said, through the grace of God, and we didn't have any fatality, and that's, that I'm so thankful for. But there's so many other people that have. And so please, to our communities, think about that. It may not affect you. And I don't want to say everyone's going to get infected eventually. I don't want to say that, but you don't want to experience, what we experienced was really, I didn't realize it's traumatic till afterwards. But my heart breaks for the people who have lost loved ones, and it's just not something that, you just take lightly.
Yeah.
So please, thank you, Naki and Carl, for having me and letting me cry my ugly cry.
Yeah.
Oh,
No,
thank you for
no.
being
Thank
brave
you
and
for
sharing.
yes.
It's so valuable. One of the things I'm going to take away from this is that even if I don't have it, or I'm not showing that I have it, if I'm around an elder, I'm putting them at risk, because I don't know if I caught it yesterday and I'm asymptomatic and now I'm spreading it. So having respect for your elders is being safe in the way that you practice and live life. Otherwise, you could be an asymptomatic carrier and be getting people sick. You could be getting your family, your loved ones, anybody sick. So living a safe in terms of COVID and practicing safe measures is one of the things that, again, it just helps reinforce it. Hearing the stories, people, I'm COVIDed to death. I know all these kind of things, but this is what just brings it back to my heart about how important it is to do the things we're supposed to do. So thank you.
Thank you so much for sharing your story. And Danny, thank you so much for giving us all that great information. Like, if I've learned something, and I've been working with, with the PI COVID-19 response team, if I've learned something new, I know tons of people have learned something new from you. So thank you so much. Thank you for your time and space right now. So I'm gonna, Carl.
Okay. Yeah, I don't even want to add to that. Just thank you both.
Okay.
And I'm so happy that Lisa, your personal story ends as there is a happy ending with it, because there's a lot of stories that don't end happy. And thank God that your family's blessed and things worked out. it is a happy ending. So we're going to end it on that note. We'd ask people one last time, please share this information. Like Naki said, there's a ton of information on here. If we're learning things and we're attending meetings with the COVID-19 response team weekly, if we're learning things, then everybody can learn something. And the stories are just, they're touching the hearts. So please share it out. And hopefully we'll see you later on the same platform. Thank you both, Lisa
Thank you
and
both
Danny. Have
so
a great weekend.
much.
You're welcome.
Thank you. God bless you.
God bless.